We keep a very high standard here, and it's important to us that we are always delivering the very best.
You don't want your patient sick. It's very important that we make sure that we do not have infections and we need to prevent them.
Our program at CareFusion Focus on Quality, it allows the hospital to do is use our resources to help them accomplish their goals in reducing variability.
Variability increases your potential for negative patient outcomes. So this program really focuses on standardization.
Now we're in a culture where quality is very important, not just for patients, but for reimbursement and things like that. So here at University, we're very focused on quality and measuring those outcomes. Looking at our surgical process of getting our patients ready for surgery. What are we doing in the OR to ready them, and even after surgery?
If you don't have a uniform way, then there's always that potential to introduce an infection to somebody.
The impact it can have on a patient if they get an infection. Longer in the hospital, they lose work or just their personal time. It's very costly for the patient, but it's very costly for healthcare in general. And people die of infections.
If you teach one way, then everybody's doing the same thing and it will limit an infection.
When we start it, we do ask that they do a prepping chart, and it is based on evidence-based medicine.
They really kind of made the structure for us. They had a lot of forms for us. They did a lot of the teaching. So step by step, they worked with the educators and the nurse managers to get this happen.
Typically we'll come in and we'll do observations, and what we're doing is we're basically looking at the variables that are in place, and then we correct those. We're just there collecting data, and then when we come back and we deliver the results, and then that's when we kind of establish where we're going to go with establishing best practice.
It's particularly something that's advantageous to do from outside the facility. A lot of times when you employ your own staff, you can have what they call the Hawthorne effect, which is where you maybe inadvertently don't record numbers as accurately as a need to get a certain effect.
The education process that took place was very thorough. It was a week-long process that was 115 nurses that we actually did education with and did competency check-offs with.
So when we went from there to teaching the actual technique and watching in the room, they really had a lot of buy-in.
The evidence shows that this is the better way. Your way might have worked, but this is the better way.
And we have seen different physicians that once used one technique move over to the evidence-based recommended technique. And so if they know a change is important and it will affect patient safety and infection rate, they jump on board very quickly to do those things.
We have really made an impact in the last year. And that's what CareFusion really did for us, is bring in a program and really get everybody aware.
It was a very moving experience because they've been doing this for a long time, and they were just thankful for the education that we had given them.